Information about premature babies. It is important to know what problems can occur in premature babies and how they can be corrected. After some time, the child recovers and goes home with the family. The recovery of the baby depends on the gestational age he is born. Preterm neonate is a baby who is born before time, that is, less than 37 weeks or before 9 months of gestation. A baby born before 35 weeks, about 8 months, needs NICU facilities. NICU or NICU, a department where premature babies are cared for in machines that keep them warm and help them breathe. Milk is fed to the baby through a small flexible tube which is inserted in his mouth until he starts taking milk on his own. Testing and treatment activities. The doctors conduct periodic checkups and provide treatment. They will ask you before the examination and even tell you what they are examining. You can also ask them and get more information about the test. Premature babies recover in 15 days to 3 months. Don't hesitate to ask doctor or nursing officer in these days. Baby's appearance and behavior. Organs and skin of these babies are not fully developed. That is why they look pink or reddish. Newborn's organs and temperature information. After 25 weeks, that is 6.5 months, the baby's organs are formed, not fully mature. They also do not have enough brown fat. This fat helps to keep their body warm. Such children are kept in a machine, that is incubator or radiant warmer, in the ICU, which helps to keep their body warm. We feed them breast milk with the help of a tube and keep them under constant supervision. Baby is given whatever medicines are necessary, and the baby gradually grows up. This way, the baby remains protected from the infection and his body parts also grow and he becomes fully developed. Information related to lungs and brain. The babies born before 32 weeks, that is 8 months, have immature lung and lack surfactant, that is substance found in lung. They are not able to control respiration. To maintain respiration, we administer surfactant from outside and it costs around 9,000 to 12,000. The baby is also kept on ventilator, a machine that gives breaths when baby can't breathe. Continuous positive airway pressure machine. This machine supports the small balloons alveoli in lung with some pressure and keep them open. Gradually, the lungs of these children start working and the child comes out of the machine. Gradually, the child is able to survive without oxygen. Information related to feeding or drinking and stomach. The preterm babies born before 34 weeks, that is 7 months, 6 days of gestation, have difficulty to coordinate suck and swallow. Secondly, they don't have enough power to suck the mother's breast. In case they are able to suck, they can't swallow. This leads to spilling of milk into the lungs. If the milk goes into lungs, the baby's breathing is further compromised. Therefore, we feed expressed breast milk with the tube. Once the baby learns to swallow, we feed them with the paladi, that is spoon katori. Initially, We give less milk as the gut is also immature and baby can't handle full feeds. Once the baby is able to digest, we start full feeds. Side by side, we try to put baby on mother's empty breast after expression of milk to encourage baby to learn how to suck on mother's breast. Once the baby is able to suck and swallow well, we shift the baby onto direct breastfeeding. Information about the power to fight against diseases of the newborn. The ability of preterm neonates to fight with the infection is very less. The unclean, dirty environment, infectious things, and infectious people can spread infection to these tiny tots. This the reason we don't allow everyone to enter and we only allow the members identified by family to enter and provide care. You need to follow strict guidelines once you enter an ICU, like washing hands frequently, touching or handling the baby properly, to not wear dirty or smelly clothes, do not enter if you are sick, and to touch baby's belongings only after washing hands. Information about the development and investigation of the blood vessels of the eyes. The preterm babies have immature blood vessels in eyes. These blood vessels may not grow appropriately and retina may get damaged. This may cause blindness in neonates. We encourage monitored use of oxygen and regular eyes checkup and treatment. That's why we want you to bring babies for examination from time to time. Note: after discharge, come for checkup from time to time as directed by the doctor. How the drug is given. A soft tube is inserted into their vein to give the drug and a glucose line is attached to it. Baby monitoring. We place a small probe along their abdomen. This probe measures the baby's temperature. It is reflected on the screen. Another probe is attached to the baby's arm or leg, which measures the heart rate and oxygen in the blood. After that, it is reflected on the screen. Sometimes those machines also make some sounds. Hearing to them, the nurses and doctors check whether all is well or not. If there is any problem, they immediately see the child. There is no need to be afraid of these sounds. From time to time, many tests are done which tell us about the condition of the baby. You can ask the doctor about the everyday test and reports of the baby. Note: so when you go to NICU, you will see that number of tubes, lines and machines are attached to baby. No need to be afraid of them. When the baby recovers, the tubes or drains will come out. Information on involving the family in hospital care for a premature baby. Family and its importance. In these units, family is encouraged to participate in care under the supervision of healthcare provider and gradually independently. The family is the ultimate care provider. The presence and participation of family is very important in long-term care of neonate. How the parents or families are educated. Parents are educated on one-to-one basis or the classes in group. The parents or family can also read the information pamphlets, see the videos and learn from the app or online page. What is the role of parents? Role of parents is to learn and practice care in supervision, and gradually when baby is stable, they can perform care independently. Daily classes are organized here to teach about the baby care. If for any reason you fail to attend the class, do inform your doctor or nursing officer.